Do you suffer from frustrating sciatica or low back pain that doesn't go away even with painkillers or stretching? As a chiropractor, I see this every single day. Low back pain that completely seizes us, burning that goes down our leg, and honestly, it keeps us from doing the things we love the most. So in this video, I'll show you the #1 cause of sciatica that most people miss, and I'll show you 2 simple at-home exercises you can do to get relief today. No special equipment necessary. And at the end, I'll show you how the exercises you may have been doing or trying to this point might actually be the wrong type of exercises for your back pain. And I'll show you how to figure this out so you can get started on the road to healing. Hi, I'm Mike. I'm a chiropractor and a master's of science in exercise, and I help people get out of low back, knee, and hip pain all day, every day. It's all I do. So let's get started. But first, here's a quick disclaimer. So in this first exercise, we need to take the pressure off of the nerve. So what we're going to do is we're going to lie face down on our stomachs. We can do this either on our bed or on the floor. We're then going to place our hands under our shoulders, kind of like we're about to do a push-up. And what we want to do then is slowly push our chest upward, letting our hips stay relaxed on the ground. As we push up, once we get to the top or the tolerance of the pain that we have, we want to hold this position for 5 to 10 seconds, and then we want to slowly lower ourselves down again. This movement is called the Cobra Decompression Stretch, and it works by gently pushing the disc material and the muscles into a forward position. And if there's any inflammation in this area, it also moves that inflammation away from the nerve and gives us relief. Basically, you can think about it as creating space for the nerve to breathe, especially if there's some disc irritation in the area. Now, it's important to note that with any of these exercises, if this movement causes the pain that you're feeling, we should stop. Over time, we want to work towards increasing our pain tolerance as well as our body strength. Once we start to feel the beginning stages of the pain that we're feeling with this movement, we want to back off of that and go no further. We never want to push through the pain. With this, you may feel a gentle stretch, a release, but all of this should be relieving. It shouldn't be difficult to do or painful. And we can repeat this exercise anywhere from 5 to 10 times, whatever's most comfortable for you. All right, great job. So let's go to exercise number 2. For this next exercise, we're going to incorporate potentially another source of compression or irritation, and that is tight hips and lower body. Remember, our hips and our low back are deeply connected and they need to work together and be moving in a fluid motion so that we don't have pain. Basically, if our hips are tight, the low back often pays the price. Sometimes when our hips are tight, our low back stiffens up, and especially the little muscles around the spine stiffen up to protect the spine because of the lack of strength in the lower body. So we need to make sure that everything is moving fluidly and smoothly. So for this exercise, if you are able to kneel, we want to get down onto all fours. Then at the point to which it is comfortable, we're going to spread our knees apart, and then we are going to lean back into our feet, kind of like a child's pose, but in this exercise, our hips are actually wider and our knees are stretched. At the point that we are comfortable and leaning back, we want to hold this for about 20 seconds and then come up out of the stretch and repeat this 3 to 5 times. Now, if kneeling or getting down on the floor is difficult, that's okay. Here's an alternative way to do this. We're going to sit at the edge of a chair with our feet flat on the floor. Then from here, we're going to push our knees outward. Then once our knees are about as far as we feel they can go outward, we are going to bend at our hips while keeping our back straight. We're going to kind of lean forward into this stretch. You should feel a stretch through your inner thighs and your hips. Both of these versions release some tension in the muscles and in the fascia around our hips and our pelvis, which can contribute to low back pain, which can cause sciatica. These are often some hidden culprits of where our sciatica pain is coming from. Here's the truth. These exercises won't fix your sciatica permanently without doing some strengthening exercises over time. Basically, it's like putting a Band-Aid on a gaping wound. The real fix long-term comes from consistent strength exercises and from rebuilding strength in your core and in your glutes so that the pain doesn't return. This is why I teach clients and patients of mine a 3-part framework. First, we get some stability and relief. Then we build long-term mobility. And finally, we work towards building up sustainable strength. Over time, once you put all of these pieces together, not only does the pain go away, but it stays away for good. And now I mentioned at the start, I had a quick little test for you to figure out whether these exercises are actually targeting the true root cause of your pain. So here it is. This test can help you figure out whether the source of your pain is actually from what are called extension-based movements, or whether they are caused by flexion or forward bending based movements. So this test is called the directional preference test. What I want you to do is to do 5 to 10 gentle forward bends. You can either do this seated or you can do it standing. I want you to go as far as you can until you start to feel pain. Remember, don't push through the pain. We're just going to go up to the point where we start to feel hesitation or tightness. Then I want you to go backwards and do 5 to 10 backwards bends. Again, up to the point of pain, but not past it. Now, after you've done these movements, I want you to ask yourself, which one felt better? Which one did I feel less hesitation? And which one maybe gave me some relief? Basically, if the answer to all of these questions is one direction, that is your preferred movement direction. Now, if it is forward, this means that your pain is going to be made worse by doing the opposite movement, the extension movements. So if you felt a lot of hesitation while doing these exercises today specifically, that means that maybe extension exercises aren't right for your situation. But if these exercises gave you relief and then you did this test and you also felt better, then your pain is likely from flexion or forward bending movements. So if this is the case, it likely means that these exercises are going to help you if you continue to do them. So now you know the two main exercises for extension-based sciatica pain that can help you get on the road to healing. Now, one thing I want to mention is that if any movements that we do with our back pain cause the pain to get worse, or we start to feel the pain change in what it feels like, or it's been going down one leg, but now it's starting to go down both legs or into our groin, that's where we would want to seek immediate help from a trusted medical professional that's local to us. But if you found progress and relief from these exercises and you want to work towards getting stronger and finding long-term relief from your pain, I've put together a free group for active adults over 50 where we go over strength programs and free guides to help you maintain your strength and mobility long-term. We'd love to have you join us, and the link is in the description. Remember, the key is consistency. If you commit to healing, your body is capable. And the key to lasting relief is making sure that we are consistently working towards getting stronger. And if you found that your pain actually gets better from flexion or forward-based movements, watch this video where I go over some forward flexion-based back pain relief exercises that are gentle and easy to do at home. But if you found these exercises helpful and you think you're extension preferred, click this video where I go over even more exercises like this to help with sciatica relief in this instance. Otherwise, thanks for watching. Please remember to like, share, and subscribe this video with someone you know who might be struggling with low back pain or sciatica. And remember to always stay moving. And I'll see you in the next video. Thanks.